In the 1970s, when I started studying pharmacy, and in the 1980s, when I started studying nutrition, scientists and leading academic research institutions were already trying to sort out what increases the risk for common cancers and what decreases the risk. And we've come a long way with that research. You could definitely point at lifestyle habits and foods and nutrients that reduce your risk of prostate cancer or breast cancer or colon cancer, or pancreatic cancer, a whole host of cancers. And you can definitely point at lifestyle habits that increase the risk of many cancers. Today we're going to be discussing reducing your risk for prostate cancer. Now we're talking about prevention, reducing the risk. That's different than treatment. In a future episode, I will discuss research that points to certain things that improve treatment and survival with prostate cancer, but of course, if it's a supplement, you really have to discuss using that with your oncologist with whatever treatment you're getting for your prostate cancer. But today we're talking prevention. It's interesting also to mention that many of the things that reduce the risk of prostate cancer also improve the treatment for prostate cancer. You'll see that frequently in research. So welcome to our Reducing Your Risk for Prostate Cancer episode, where I will discuss things men do every day that increase their risk of prostate cancer and the habits, the foods, the nutrients that will help reduce your risk of developing prostate cancer. Now, each part of this discussion is based on the results of multiple human studies. Hi, my name is Jerry Hickey. I'm a pharmacist who also has studied nutrition, and I'm over here at Invite Health, and I'm also the scientific director. Please be sure to subscribe to the Invite Health podcast, and please leave us a review. You can follow us on Facebook, Twitter, and Instagram at Invite Health. All of the information on today's episode will be linked in the episode description, and you can visit invitehealth.com/podcast for more information. So let's get going. One of the risks for many cancers is being overweight, especially being obese. About 40% of Americans can be categorized as obese. In other words, they have an awful lot of fat. So many American adults are overweight, but a serious number of people are obese. And when you're obese, that's dangerous. That increases your risk of sleep apnea, atrial fibrillation, snoring, backaches, knee pain, and arthritis, a lot of bad things, plus cancer, heart disease, diabetes, hypertension. So an American Cancer Society study, this is important, showed that for men who were overweight, we're not talking obese here, we're talking overweight, the extra risk of developing prostate cancer was 8%. Now that might not sound huge to you, but prostate cancer is so common and being overweight is so common, it does mean something. It does translate into quite a few men developing prostate cancer. Now, obese men, being obese, having serious belly fat, a 20% increased risk of developing prostate cancer. And being severely obese, this is really bad, a 34% increased risk of developing prostate cancer. So seeing that obesity and severe obesity have become so common and that prostate cancer is so common, this is a real impact on general health, on population health nationwide. Now, also in men who already have prostate cancer, in the Journal of Clinical Oncology, an American Cancer Society in Atlanta study, they're looking at, it's part of the Cancer Prevention Study 2 nutrition cohort. They're looking at what happens to men who are overweight if they develop prostate cancer. So we're not really discussing dealing with prostate cancer now, but just to highlight that there's connections between prevention and treatment. After diagnosis of prostate cancer, men with obesity, there was a prostate cancer specific mortality trend. In other words, they were more likely to die of their prostate cancer. They were more likely to have advanced prostate cancer, but they also had a much higher risk of dying from heart disease and from dying from all-cause mortality. All-cause mortality is any cause. So it's important to understand excess weight not only increases the risk of prostate cancer, it makes prostate cancer more dangerous. Part of that seems to be there's fatty tissue lining the prostate. And the fatty tissue can contribute to the prognosis of prostate cancer. They find that obese men, the fatty tissue surrounding their prostate cancer, it releases chemokines, chemical messengers that inflame the cancer and make it grow and spread more easily. It's definitely connected there's a definite connection between more aggressive prostate cancer and being overweight. Not just having the cancer, but having a more aggressive form of the cancer. It's just not good. Not a great time to lose weight. Now, there was a really good systematic review on what increases the risk of prostate cancer and what reduces the risk of prostate cancer in a journal called the Journal of Human Nutrition and Dietetics. And they went into many things. In their review, they did find that dairy was involved with an increased risk of prostate cancer. Not sure about those studies. But they found that red meat slightly increased the risk. Not all studies show that. Red meat slightly increased the risk of prostate cancer, but prostate cancer, much more of an effect from processed meats. So whereas red meat increased the risk of prostate cancer slightly, having processed meats did it more so. It was more dangerous. Processed meats would be frankfurters, spam, salami, bologna, bacon, sausage, anything like that. Now, also when you look at meat consumption, it seems to be worse if it's barbecued, smoked, or grilled, and also fried. So there is a slight connection with red meat. There's a stronger connection with processed meat. Processed meat is connected to a lot of bad things. Now let's talk about tomatoes and lycopene. We're actually probably going to have to do this episode in multiple parts. So I'm only going to touch on lycopene here. It's the red stuff in tomato sauce. We'll go into it further in the next part of this episode. So when you cook down tomatoes, you release this red pigment called lycopene. And there's other things in the tomatoes that make it work better. So whenever you get lycopene as a supplement, and you want to get over 5 milligrams a day, you want those tomato oleoresin ingredients in with it, and you want it to be natural lycopene. That would be the only way I would supply a lycopene supplement. So here's what they found. They found if you had tomato sauce or lycopene, 5 milligrams or more, twice a week or more, it reduced your risk of prostate cancer. It was a systematic review. Inversely associated with the occurrence of prostate cancer in case control studies. Okay, that means the more often you had lycopene and the more you had, the lower your risk of developing prostate cancer. They found that it was aligned with that. They also found that the amount of lycopene in your blood was linked to a reduced risk of prostate cancer and advanced prostate cancer or progression of prostate cancer in 3 recent case control studies. So in other words, men who had prostate cancer, if they had higher levels of lycopene in their blood, it was less likely to become dangerous or advance. So here we have another lifestyle habit, tomato sauce or taking lycopene supplements that are natural with other tomato ingredients in them, that not only lowers your risk of prostate cancer, but also makes it safer if you have prostate cancer. So a meta-analysis of 11 case-controlled studies and 10 cohort studies, they found an association between lycopene and decreased risk of prostate cancer. A meta-analysis means they take a whole bunch of studies, in this case 21 studies, and they put them together. So now you have additional research institutions, additional researchers. You have a much bigger population to look at, but they have to be similar studies. Otherwise, you can't group them. And this tells you if something works or it doesn't work. And they found out, hey, lycopene lowered the risk of prostate cancer. So they found in cohort studies, case control studies, and other types of studies that lycopene, even looking at lycopene in the blood, associated with a lower risk. And it seems that the more frequently you had lycopene, the lower the risk, to a point. Before we go any further, let's go to a quick break. When we come back, I want to talk about green tea and prostate cancer. There's really something to that. It has teeth. There's a lot of studies. We'll be right back.
This podcast is brought to you by InviteHealth.com. For over 20 years, Invite Health has provided premium quality supplements and expert advice you can trust. Now, first-time customers can enjoy an exclusive offer. Visit invitehealth.com/podcast or click the link in this episode description. That's invitehealth.com/podcast for your exclusive offer on Invite Health products. Invite Health offers the resources you need to make important decisions about your health. Chat live with degreed healthcare professionals, get product information, and find retail locations near you at invitehealth.com. You can also learn about our new genetic testing program and our exclusive Invite Fitness Wellness program. Follow Invite Health on Facebook, Twitter, and Instagram, and be sure to subscribe to our podcast today. Now back to our episode.
Okay, welcome back. We're talking about ways to reduce your risk of developing prostate cancer. So green tea is a biggie. There's been many studies on green tea, and there's been many meta-analysis of studies. So a very large prospective cohort study in Japan, it found that green tea reduced the risk of prostate cancer, and it was dose dependent. In other words, the more green tea, the better. Now, you should never have more than 8 to 10 cups of green tea per day, otherwise you're overdoing it. But they found that 5 cups a day was perfect for reducing the risk of prostate cancer. That was the best level of prevention. So let's read some studies on green tea and prostate cancer. This is Medicine. Medicine is published in Baltimore, Maryland. And it's a systematic review and meta-analysis. A systematic review, that means they go through all these different websites that collate research, and then they analyze them. So they have to be similar studies looking at similar things. And once again, they choose, if it's a good research, academic research institution, they'll pick well-designed studies that are well-reported, that lack bias. So they did a meta-analysis of 10 studies looking at green tea and prostate cancer risk, and they found more cups of green tea daily reduced your risk of prostate cancer. They found that 7 cups a day, 7 cups of green tea a day reduced the risk, the relative risk of prostate cancer by 62%. And it was a linear trend. A linear trend means the more, the better. The more green tea, the lower your risk of prostate cancer. But it stops at 7 cups. In other words, there's no difference between 7 cups and 8 cups. Now, sometimes green tea is in smaller cups. So really, if you're looking at American-sized cups of green tea, 5 cups will do it. All the research shows 3 to 5 cups is plenty of green tea. 3 to 5 cups American size. And don't put milk in the green tea. It seems to tie up the ingredients. And I'll talk about these ingredients in just a second. Put lemon, squeeze some lemon or some citrus into the green tea. It protects the ingredients and it improves their absorption. There's about 20 catechins in green tea. The major one being EGCG. These are the elements in green tea that are tied into a lower risk of prostate cancer. So here's the archives of the Italian Journal of Urology and Andrology. As from Ghent University in Europe and the University of Insubria in Varese, Italy, they're doing a meta-analysis. They're looking at men with an increased risk of prostate cancer. So let me explain what that's all about. Not every man has the same risk for developing prostate cancer. Some men have a condition called high-grade PIN. PIN, P-I-N, it stands for prostatic intraepithelial neoplasia. In other words, the cells in their prostate are damaged. And if that converts to something called ASAP, that's atypical small acinar proliferation, that's an even bigger risk for prostate cancer. ASAP means that some of the cells may be prostate cancer. So in high-grade PIN, the cells in the prostate are starting to mutate and change, and it could go either way. But in ASAP, it's hard to tell if it's prostate cancer or not, but usually with ASAP, men go into prostate cancer. It's almost a sure thing that they're going to go into prostate cancer. So here's what they found. In a review, a meta-analysis of 4 human clinical trials and men with ASAP or high-grade PIN, the men in the green tea group, 8% of them developed prostate cancer. But the men in the placebo group, 22% of them went on to develop prostate cancer. Big difference. They said there was a significant 59% reduction in the risk of developing prostate cancer. So there really is something to prostate cancer. So here's the H. Lee Moffitt Cancer Center. That's also a research institute. That's down in Tampa, Florida. And it's in the journal Cancer Prevention Research. And they mentioned, first of all, that the incidence of prostate cancer, especially the death rate from prostate cancer, is much lower in parts of Asia where they consume a lot of green tea. And that's the truth. I once co-authored a book with the director of oncology at the Strang Cancer Prevention Center in Manhattan. And we found that in Japan and other parts of Asia, that even though the incidence of prostate cancer may be similar to the United States, the prostate cancer never got risky. Now, the H. Lee Moffitt Cancer Center down in Tampa goes on to say that men who move from countries like Japan and they stop drinking green tea, their incidence of prostate cancer increases, and the risk it becoming a risky prostate cancer increases to that of men who've grown up in the United States. So there's something to it. So they wanted to see if green tea cut the risk of prostate cancer in men with high-grade PEN. Once again, that's when the cells in the prostate are starting to mutate, they're starting to shift. Or ASAP. ASAP is atypical small acinar proliferation. That means some of the cells may be prostate cancer already, you can't really tell. So it's more of a sure thing. So they gave the men decaffeinated green tea capsules, 200 milligrams of the polyphenols twice a day. The polyphenols are the things like EG, CG that have been shown to reduce the risk of several cancers, more than likely breast cancer, colon cancer, but certainly more research on prostate cancer. I will go into these issues in future podcasts, future episodes. 49 men were on the green tea, 48 men were on the placebo. It was for a whole year, so they were taking one capsule twice a day. There were almost 50% more men in the placebo group that developed prostate cancer. So there was about 50% fewer men in the green tea group that went on to develop prostate cancer. So there was definitely a shift. The green tea meant something. And men who had high-grade PEN, it was preventing them from going into ASAP, which is a much scarier state of events in the prostate, and it was preventing them from developing prostate cancer. Additionally, there was a significant drop in prostate-specific antigen. That's called the PSA. PSA is a biomarker. In other words, it's a proxy, and when you combine it with other risk factors, it's used to screen patients for prostate cancer. And high levels signify a higher risk for prostate cancer, so the green tea also lowered their PSA levels. So there really is something to green tea and prostate cancer. Okay, let's take a break, and when we come back, I want to get back to that systematic review and meta-analysis that was in the Journal of Human Nutrition and Diabetics.
This podcast is brought to you by InviteHealth.com. For over 20 years, Invite Health has provided premium quality supplements and expert advice you can trust. Now, first-time customers can enjoy an exclusive offer. Visit invitehealth.com/podcast or click the link in this episode description. That's invitehealth.com/podcast for your exclusive offer on Invite Health products. Invite Health offers the resources you need to make important decisions about your health. Chat live with degreed healthcare professionals, get product information, and find retail locations near you at invitehealth.com. You can also learn about our new genetic testing program and our exclusive Invite Fitness Wellness program. Follow Invite Health on Facebook, Twitter, and Instagram, and be sure to subscribe to our podcast today. Now back to our episode.
Okay, welcome back to the episode. We're discussing reducing your risk of developing prostate cancer. And we're back to a discussion of that report we discussed earlier on in this episode. It's from the Journal of Human Nutrition and Dietetics, where they reviewed hundreds of studies on prostate cancer risk. And they found that there really was something to the mineral selenium. You know, it's interesting. Men who can't use selenium properly, genetically, they have a poor ability to utilize selenium. It fails to protect them from prostate cancer. So there's something about genetics, and there's something about selenium. Selenium definitely has an anti-cancer activity. Selenium's involved in a lot of things. It works with vitamin C in the liver and kidneys to remove toxins, to break down and remove toxins. It works with a system called the glutathione peroxidase system. That's like the strongest antioxidant in the human body, protecting you from environmental pollutants and toxins. It's just, selenium is a very important nutrient. When they looked at blood levels, blood serum levels of selenium, they found that it was definitely tied into a reduction in the incidence of prostate cancer. It was protective. It reduced your risk of prostate cancer. If you had a good level of selenium in your blood, it reduced your risk of prostate cancer between 50 to 65%. Now, when they did a meta-analysis of 20 studies in men with low selenium levels in their body, men with low levels of selenium in their blood, there was a significant increase in their risk of prostate cancer. So a randomized interventional trial for cancer prevention, it showed if you had a 200 microgram a day dose of selenium as a supplement, it reduced your risk of developing prostate cancer by 50%. And this, of course, applies more to men who were low with selenium in the first place. There's a lot of countries where soil is depleted of selenium, like Northern Europe. Like if you go up to the Scandinavian countries, like Sweden, very low selenium in the soil. Sweden, Finland. If you go down south, places like South Carolina and Alabama and Georgia and a bunch of other states, very low selenium levels. And that's tied into increased risk of stroke, increased risk of liver disease, increased risk of heart disease, but also increased risk of prostate cancer. So when they gave men with low levels of selenium a 200 microgram dosage every day for a year, it lowered their risk of prostate cancer by 50%. So there's no doubt about it. So they found that dairy may increase the risk of prostate cancer. Red meat may, especially if you barbecue it or grill it or smoke it or if you have it fried. More likely, processed meat increases your risk of prostate cancer. You know, salami, bacon, sausage. By the way, you could get vegetarian sausage today that tastes like real sausage. There's no need to eat sausage anymore because with sausage, it's all about the spices they add. It's all about the spices. They found that obesity or being overweight increases your risk of prostate cancer, especially being very obese strongly increases your risk of prostate cancer. I believe the figure was like 30%. We read that at the start of the program. There's been some evidence that exercise reduces the risk of prostate cancer. Well, that would make sense because that lowers things like blood sugar, blood pressure, but that, you know, elevated blood sugar is tied into different cancers, but that also burns fat. As far as supplements and foods, we discussed green tea lowering the risk of prostate cancer, and we discussed selenium lowering the risk of prostate cancer. Vegetables and fresh fruit and nuts and seeds in general, a diet like that seems to lower the risk of prostate cancer. We're going to finish up now. We'll do a second part to this episode, other factors that reduce your risk of developing prostate cancer, and soon I'll work on a similar report for other cancers, pancreatic cancer, colon cancer, breast cancer. Thank you for tuning into the InVet Health Podcast. You can find all of our episodes for free wherever you listen to podcasts or by visiting invithealth.com/podcast. Please make sure you subscribe. Please leave us a review. You can follow us on Facebook, Twitter, and Instagram at InVite Health. We'll see you next time on another episode of the InVite Health Podcast. Thank you so much for listening.